Hola, muy buenas tardes a todos. Ya en unos segundos vamos a estar comenzando con
Hello, good
esta.
afternoon. We will be starting in a couple of minutes. Let's just stand by until everyone comes here connected to the platform. And once again, we remind you that you will be finding information, updated information on the disease on Paho's website, as well as guidance and also daily updates of the region and by country. Thank you.
Muy bien. Bueno, ahora sí, entonces,
So,
buenas tardes a todos.
good
Bienvenidos a
afternoon
esta
to all of
segunda
you and
sesión
welcome
de la
to
OMS
this
sobre la pandemia por
weekly
COVID-19
briefing
en la región de
on
las Américas. Soy
COVID-19 in the
coordinador de
region
la
of the
Oficina de
Americas. My name is
Comunicaciones
Sebastián Oriel, and I am with the
Esta sesión
Communications
durará
Department
alrededor de
here
una
at
hora
Paho.
y
This
durará
session
por
will be
segundos
about an hour
aproximadamente.
long, and we will
Como
be
siempre, saben
accepting
que tenemos
questions up to the
interpretación
end. And as you
simultánea
know,
de
we have
ambos idiomas.
simultaneous interpretation into
Hemos
English and
recibido
into
ya
Spanish. We
preguntas
have
por
already
correo
received
electrónico y
some
también
questions
pueden
via
hacer
email,
preguntas
and you
a
can
través del
also
botón
ask
de
questions
chat.
through the
Ahora
Q&A
les estaremos dando la
button at
palabra
the
para que
bottom of
puedan
the screen.
indicar sus
And
preguntas,
please
pero antes sí les pedimos que nos
ask
escriban
your
a nuestro
questions
chat
also
privado para
live,
que
but
podamos
first
organizarlo.
write through the Q&A
Además,
for
siempre
us
les
to be
pedimos
able
que
to
por favor
organize
indiquen su nombre
ourselves. And as
y el
usual,
medio de
please
comunicación en
include
el que trabajan.
your name and the
Esta
media
sesión
outlet.
también la pueden
This
seguir a través de
session
las
will
redes
also be
sociales de la
followed
OMS a través de
via
Facebook
social
y de
media,
Twitter.
Facebook, and
Hoy
Twitter.
la directora de la
Today,
OPS, la doctora
Paho's
Carissa Etienne,
director,
les informará
Dr.
sobre la
Carissa
situación
Etienne,
actual
will be
de la
informing
pandemia
you
en la
about the
región
current situation of
y
the
sobre el
pandemic in the
camino
region,
hacia
as
adelante.
well as the
La
path forward.
acompañan el doctor
With her,
Jarbas
we
Barbosa,
have
subdirector de la
Dr.
OPS,
Jarbas
el
Barbosa,
doctor Ciro
who
Ugarte, director del
is the
Departamento de
assistant
Emergencias
director,
y
Mr.
Salud, el
Ugarte,
doctor Marcos
Who is the
Espinal,
director of
director
health
del Departamento de Enfermedades
emergencies, Dr.
Transmisibles,
Espinal, who is the director
la
of
doctora Silvana Alighieri,
communicable
directora
diseases, and
adjunto de
Dr. Alighieri,
Emergencias en la
who is
OPS y
also
gerente del
the
Gabinete para
deputy director
COVID-19.
for emergencies at Paho
Ahora
and
sí,
also
entonces
working on
quisiera invitar a la
COVID-19.
doctora
And now I
Etienne
would
a
like
sus
to
palabras de
invite
apertura de esta
Dr.
sesión.
Etienne
Doctora Etienne.
to for her opening remarks.
Good afternoon, and thank you for joining today's briefing. Nearly half of all COVID 19 cases globally can be found in the Americas. As of June 23rd, there have been more than 4.5 million COVID 19 cases and 226,000 deaths reported in the region. And unfortunately, these figures continue to climb. Across Mesoamerica, the virus continues to circulate widely in almost all the countries. There is now widespread transmission in most of Central America. In South America this weekend, Brazil surpassed 1 million COVID 19 cases, joining the United States as the only other country in the world with cases in the 6 digits. The Caribbean is faring better, but with hot spots on the border of Haiti and the Dominican Republic, as well as within the Guyanese Shield. Last month, I announced here that our region had become the new epicenter of the pandemic. I'm sorry to say that since then, cases of COVID-19 in Latin America have now tripled from almost 690,000 May 23rd to more than 2 million today. Yesterday, we concluded a productive meeting of PAHO's executive committee in which we took stock of the pandemic's toll in our region and looked ahead to the collective actions needed to overcome this crisis. While the recent increase in cases is extremely concerning, we have averted an even greater tragedy thanks to the early adoption of public health measures, which have helped protect health systems and save lives in many countries. But sustaining these measures has not been easy, particularly given their economic and social impact. Now, governments are under pressure to ease restrictions for economic and political reasons, even while transmission is increasing. In the absence of effective treatments or a widely available vaccine, we expect that over the next 2 years in the region of the Americas, we will experience recurring COVID-19 outbreaks, which may be interspersed with periods of limited transmission. We must be realistic about the future. All of us must adjust to a new way of life and redefine our sense of normal. The question is no longer, how do we go back to the way things were before? But rather, how do we move forward and build a sustainable and effective outbreak response? This week, our member states discussed a resolution that seeks to balance the triple threat this pandemic presents to the health of our people, to our social welfare, and to our national economies. Their recommendations are not only relevant to the crisis we face today, but also chart a course to navigate the next 24 months of the pandemic. In the face of a fast-changing pandemic, leadership will make or break our response. Now is the time for leaders to reach across political divisions and geographic borders to rally the support for a response that is commensurate to this unprecedented crisis. Each country will need to adjust and coordinate their COVID-19 response based on increasingly detailed data. Governments will have to make decisions considering simultaneously health, economic, and social indicators. This will allow health officials to understand where transmission is accelerating and which groups are at greater risk so as to better target their efforts. Flexibility will be key, and public health measures as well as social protection efforts will need to be reviewed regularly to minimize the impact of the virus in our societies. The provision of social, financial, and fiscal protection, especially in communities heavily dependent on informal economies, is critical. We will not overcome this crisis without addressing the needs of the most vulnerable, those most likely to fall sick and the least likely to receive care, such as Indigenous people, Afro-descendants, the urban poor, and migrant populations. If we neglect them, we run the risk of the next 2 years looking like the past few months. And this should not happen. To support effective decision-making, we will need timely and reliable data about the virus's spread within cities, throughout provinces, and across countries. This information is vital to help governments identify new outbreaks early and adapt responses in the face of changing scenarios. While an active risk of transmission remains, we must also prioritize early detection of suspect cases, laboratory testing, contact tracing, and quarantine as the foundation of a targeted and sustainable strategy to control COVID-19. This is now more important than ever. But ensuring this happens at the level and to the scale that our region needs will require investment in human resources, supplies, improving surveillance, as well as the development and rapid adoption of new tools. We must also continue to strengthen our health systems, which are our strongest defenses against COVID-19 today and well into the future. Paho's recommendation of public health expenditure benchmarks at least 6% of GDP. This is more relevant now more than ever. And a 30% investment from all public health investments that should be allocated to the first level of care. If we allocate resources to primary health clinics, hospitals, laboratories, and grow our health workforce, invest in essential public health, and expand our stockpiles and supplies, we can stay ahead of the pandemic and save lives. This will also lay the groundwork for the timely and equitable rollout of future vaccines and treatments. We must not forget that as challenging as things have become, this region has in the past made some of the most momentous achievements in public health. The elimination of smallpox, poliomyelitis, measles, rubella, and congenital rubella syndrome. These milestones were only attained thanks to coordinated responses to shared regional challenges, exactly what we need to tackle COVID-19 today. COVID-19 will only be defeated through concerted regional cooperation and action. Though we rejoice when one country successfully flattens its COVID-19 epidemic curve, the risk of re-emergence will always remain unless we flatten the curve regionally and globally. Paho is committed to continuing to serve the people of our region with the guidance and support they have long relied on to ensure that together we can defeat this common enemy. Thank you.
Muchas gracias, doctora Etienne. Vamos a comenzar
Thank you
ahora.
very much, Dr. Etienne. And with that, we're now going to move to the questions that we have received via email, and then we're going to move to the questions that we have received via the first question is,
particularly in Latin America. Many vulnerable groups are struggling to make ends meet amid this pandemic. What does Paho say to that? Dr. Etienne?
Thank you for that question and for focusing on our vulnerable populations. The truth is that for many populations in the region, implementing and adhering to public health measures has been challenging. Workers from the informal economy, families living in overcrowded houses, indigenous and Afro-descendant populations living in precarious conditions, and those without access to soap and running water are particularly at risk. This is why it is so important for countries to implement policies and programs that address the issues faced by these vulnerable populations. The COVID-19 pandemic has demonstrated how the most vulnerable in our societies are disproportionately impacted by disease. Countries must put in place now and in the medium to long term programs to increase social protection and to reduce inequities and disparities across all sectors. Thank you.
Gracias, doctora Etienne. La siguiente pregunta viene
Thank you, Dr. Etienne. The next question is from Ariadna Ortega from the Expansion Group in Mexico. The question is, what is being done or what must countries do to have access to the vaccine when it becomes available? How can we ensure that the countries in the Americas or developing countries will have access to them? Dr. Barbosa? Thank you for that question, Ariadna. The COVID-19 vaccine is a hope that we all have. I believe that a lot of academic institutions, public institutions, private companies, etc., are working very hard to find a vaccine for COVID-19. We have about 130, 10 of which are already in the testing phase and the clinical trials phase. But it's very important for countries in the region to rather than preparing for countries to prepare for an upcoming vaccine. At Paho, we are working with the countries in the region to train the regulatory agencies in the region in how they must prepare for a future COVID-19 vaccine and how we can have more countries in our region participate in these clinical trials that are being done. And for that, we need to have the ethical, regulatory, and technical capabilities in the different countries. We're also actively participating in the global mechanism to access COVID-19 vaccine with other partners such as WHO and Gavi and Paho, with over 30 years of experience with its vaccine Rotary Fund to participate as a bloc so that each one of our countries can have access to a future vaccine. This is a huge challenge that we have so that all the countries, not just the rich ones, can benefit from the vaccine. So we are very actively involved in this and we are providing support to the countries in the region.
La próxima pregunta llega
The
de Fernando
next
Melis
question is
desde
from Fernando Melis from
Brasil.
r7.com in
Dice,
Brazil,
Brasil se
and it
encuentra entre
says
los países
Brazil
sudamericanos
is one of
que
the South
menos
American
realizan
countries
pruebas de
that
COVID-19.
are
¿Cuál es
doing
la
the least
evaluación
numbers
que hace
of
la OMS
COVID-19
del programa de
testing.
pruebas en
How
Brasil y cómo
is
mejorar?
what is Pajo's
Dado que
assessment
existen
of
recursos para la
Brazil's
compra de
testing program,
kits. Doctor
and how can
Espinal.
we improve it because we do have resources to purchase testing kits? Dr. Espinal? Thank you very much for the question. Yes, in fact, Brazil is a country with a lot of resources that could increase its testing. Over the past few weeks, Brazil has made progress in increasing testing, PCR testing that is for COVID-19, but it's not getting quite to 10,000 tests per million people. So they need to ramp it up. So, but then we need to take a look at a state by state level because Brazil is a very large country with different population densities. For example, the states of Sao Paulo and Rio are the ones that have the largest number of testing being performed today. Sao Paulo with over 350,000. However, when we take a look at the number of testing in light of the population density, Sao Paulo, Rio, for example, are way below others such as Roraima and less populated states that have high testing capabilities per 1 million inhabitants. So it's important to not generalize, but the message is that we need to have them increase the number of testing in Brazil because that's going to give us an idea of how the different states are doing and the true number of cases as well as where we can help. Testing is very important for decision makers to make quick decisions for the benefit of the Brazilian population. Thank you very much.
Gracias, doctor.
Thank
Siguiente
you,
pregunta
doctor.
viene
The next
de Ana
question
Cruz del
comes from Ana
Confidencial
Cruz
y
from El
también de Lidia
Confidencial,
López de La
as well as
Prensa,
Lidia
ambos de
Lopez from La
Nicaragua.
Prensa, both from
Ana
Nicaragua.
dice, ¿qué
Ana
información
says,
tienen sobre el
what
número de
information
pruebas
do
que se
you
están
have regarding the
realizando en
number of
Nicaragua?
tests being
Me
performed
gustaría
in
que nos
Nicaragua?
indiquen las pruebas que
I
son
would like for you
recomendadas
to
por la
see what
OPS,
tests
ya que
Paho
Nicaragua se ha
recommends because
descalificado las pruebas rápidas
Nicaragua
para el
has ruled out
COVID-19.
rapid testing to
Y
detect
Lidia López
COVID-19.
dice,
And
¿qué
Lidia
evaluación
Lopez
le
says,
da la
what
OPS a
kind of
los
assessment can
reportes
Paho
cuando la organización ha
make on
advertido de
reports
un
when
aumento
the
de casos en la
organization
región,
has
precisamente
raised
en la
its flag
frontera de Costa
regarding
Rica
the
con
increase
Nicaragua?
in
Y el
cases
Ministerio en
in
su
the region,
último
specifically in the
reporte
border
el
between
martes
Costa Rica
registró
and
una baja
Nicaragua.
en los
And
casos
last
de
Tuesday, there
contagio.
was a decrease in the number
Doctor
of
Ugarte.
infections. Dr. Ugarte? Paho provided support to train the lab workforce at the national benchmark diagnostic lab in Nicaragua. However, it has not received information on the number of tests performed and processed by the national lab. I'm talking about for confirmed COVID-19 cases. The WHO provided specific recommendations regarding the type of test to diagnose the disease and the clinical moment when these tests will be more accurate to confirm the presence of the SARS-CoV-2 virus. In this case, even though the rapid test, that the ones that detect antibodies in blood, may determine whether or not the person has been in contact with the virus, we cannot identify when that contact took place. Also, we don't have enough evidence to say that the bodies that are present in blood may provide protection or for how long they can provide protection. Therefore, rapid tests should not be used as the sole diagnosis tool, but rather for research purposes or to determine zero prevalence in any given population. There is a significant increase in cases on the Costa Rican side of the border with Nicaragua, and what we would expect is to have an increase in cases in Nicaragua. So we are just waiting for that information to be shared by Nicaragua, taking into account the geographic area where cases are reported. But as of now, we have not received that information. Thank you.
Gracias, doctor.
Thank you, doctor.
Pregunta viene de
The
Lara
next question
Pinheiro
comes from
del
Lara
Globo
Pinheiro
Brasil.
from El Globo
Dice,
in Brazil.
the recovery trials in the UK showed benefits in the use of dexamethasone for severe cases of COVID-19. Would Paho like to comment on this? Is this good news for the region? Dr. Aldigueri?
Thank you for this question. Yes, this is good news. The preliminary report of the recovery study in the UK has shown a reduction in 1/3 of mortality in 1/3 in patients on ventilators, I mean in intensive care units, and of 1/5 in patients under oxygen. The good news is also that dexamethasone is a medication that is on the list of essential medicines, the WHO list for essential medicines, for more than 4 decades. This is a cheap medication. It's widely available. So WHO is aware of other ongoing studies, including dexamethasone, and is planning to do a meta-analysis of the results, including preliminary results of these other studies. And WHO and the Pan American Health Organization are planning to update their clinical management guidelines with this new data. What we know from the recovery study, this medication, dexamethasone, is not for prophylaxis of COVID-19. It is not for mild cases of COVID-19. It is for patients with severe COVID, severe disease, including, and I repeat, it's important, patients on ventilators and patients receiving oxygen in hospital settings. Thank you.
Gracias, doctor. Ahora quisiera darle la palabra para que haga su
Thank you,
pregunta.
doctor. And I would now give the floor to Robert Moore from La Vanguardia in Spain. And from Argentina, Robert, can you hear us? Robert, if you can hear us, you have the floor. Good afternoon. Yes, I wanted to ask Dr. Etienne about your opinion about the European Union opening its borders as of July 1st, and countries such as Spain and Italy are hoping to increase their economic activities through tourism, although they were some of the most severely affected countries at the global level. The Union has not yet decided whether they will ban entrance of visitors coming from certain countries. I would like to know Paho's opinion in this regard and whether you believe that reopening flights between the Americas and Europe could result in a massive rebound of
Gracias, doctora.
COVID-19
Por el tema
cases. Thank
fronteras,
you.
está contestando el doctor Ugarte. Si
Now,
puede
Dr.
contestar.
Ugarte will address the issue of
Sí, muchas
borders. Go
gracias,
ahead.
Robert.
Thank you very
Las
much,
recomendaciones
Robert.
actuales de la
The
OMS con
current
respecto a
recommendations
viajes
from WHO
internacionales
regarding
no
international
esenciales
flights that
están
are
incluidos en un
non-essential
documento que se llama
are included in a
Recomendaciones
document that's
Temporales
called Temporary
emitidas el
Recommendations,
1 de
which were
mayo en
issued
conformidad con
May
el Reglamento
1st,
Sanitario
pursuant to the
Internacional.
international health
Y la
regulations.
decisión de reanudar
And the
el
decision
tráfico
to
internacional
reopen
es exclusiva de la autoridad
international
de las
traffic for
autoridades nacionales.
non-essential
Sin embargo,
activities is up to each
la OPS y la
individual
OMS
country.
están
However,
trabajando en un
PAHO and
documento que se
WHO are
publicará
working on a
en
document that
breve
will be
que detallan
published
las consideraciones que se
briefly
deberían
that
tomar
detail the considerations that
para
should be
reanudar el
taken
tráfico
into account
internacional no
before
esencial,
reopening
particularmente
non-essential
en
international
condiciones
travel,
de incremento de
especially
casos en varios
in
países.
light of
Estamos viendo
spikes in
que
cases in several
países que
countries.
habían
We are
controlado la
seeing that
enfermedad
countries that had
pueden empezar
previously had
brotes al
the
interior de su
disease
país
under
e
control can have
inclusive podrían
outbreaks in their own
generar
countries, and they could
lo que se llama
even
un segundo pico de la
see
enfermedad,
a second
a
peak
veces
in
más
the
alto que los
disease,
anteriores
sometimes
dentro de la
higher than the
primera
previous one,
ola o de la misma
in
primera ola.
as part of this
Los puntos
first
principales
wave.
que el
The main
documento va a
items
incluir
that the
es que,
document
en
will
primer lugar, no existe
include
riesgo
is that,
cero.
first of all, there's no such
Siempre
thing
existe
as
un riesgo.
zero risk.
Y la
There's always
decisión
some
debe
kind
ser
of risk.
tomada desde la
And the decision
perspectiva
must be
del
made
manejo de ese riesgo.
from the
Y
point
en
of
el
view of
momento actual
managing that
no
risk.
existe
And at
ninguna
this point,
herramienta
there are no tools
epidemiológica ni
whatsoever,
de
be it diagnostic
filtros
or
biológicos que
epidemiological
nos permitan
filters or
adoptar
screening that would
criterios de
enable
quiénes
us
pueden
to
subir a un
decide
avión
who
o no.
are in a position to board a
Y
plane and who is
tercer
not.
aspecto es que los factores
The third
principales
aspect is that the main
nacionales
aspects that
deberían
national
incluir
authorities
valorar
should take
el
into
sobre
account
cuándo,
when
el
assessing
cómo y
the
desde
when,
hacia dónde
how,
reanudar el
and
tráfico,
from and to
porque eso
where
va
to
a
reopening
depender
international
de
routes,
varios
because
aspectos,
this
pero
will depend on
principalmente de la
several
capacidad del
aspects,
país
but mainly
para
it will
manejar el
depend
flujo
on
de
the country's
viajeros
capabilities
y
to
cómo pueden
manage
seguir
the
detectando
travel
viajeros cuando ingresen al país.
flows and how they're going to
Otro
follow up
punto
on those
es la
travelers once they get
capacidad
to
de
the
los
countries.
servicios de salud
The
para
other
poder tener
aspect has to do
respuesta
with
seguramente
monitoring
antes.
imported cases,
Y
because I'm sure
búsqueda
those
de
will
casos
come up.
importados
And
a
when looking
veces
for imported
es
cases,
mucho más exhaustiva
oftentimes
que la
it's
búsqueda de
done
casos
much more
internos domésticos.
exhaustively than
Y
looking
esa es una lección
for
que debemos aprender.
internal or domestic cases. And that's a
Muchas
lesson to
veces
be learned by all of us.
relacionado con
Oftentimes,
fronteras y con
when
migrantes
talking
entre otros,
about borders and migrants in general,
el énfasis está en los
a
viajeros
lot of
internacionales
emphasis
y
is
los
put on
migrantes.
international
Cuando esto se
travelers
da,
and
los
migrants,
casos aparecen
whereas
dentro del país.
where
Y esa es una
most of the
lección
cases
que
appear
deberíamos
within the
aprender de
country,
una
and
vez por
that's
todas.
a lesson that we should
Hay un
learn
aspecto
once
muy
and for all.
importante que es la
There's a very
estimación de
important
las
aspect that
dinámicas de
has to do
países,
with
de dónde y
assessing
hacia dónde
each country's
podrían ir
dynamics as
conexiones, por ejemplo,
to and
conexiones de
from
avión
where
directo,
they could
etcétera.
have
Pero
flights, for
también viendo
example,
que muchos
non-stop
países están
flights,
adoptando
because you can see that
medidas
several
restrictivas
countries
o
are
algunos
adopting
puntos
very restrictive
considerando
measures, but
economía.
at the same time, they're
Así que en
opening
estos
up their
tiempos
economies.
una
So
decisión
at this time,
dinámica
a
es y
dynamic
controlada
and
y paso tras
controlled
paso, con
step-by-step
vigilancia, con servicios de
decision
salud,
with surveillance,
con
with health
medidas,
services,
digamos, adaptadas a la
and
realidad,
with measures that
debemos
are
hacer
tailored to a
y
reality is
van a
the
ver
way to
frutos
go. And I'm sure
posteriores
that's the
en el
recommendation
documento
that you
que
will
se
see
publicará.
on the document that will be
Gracias.
published. Thank you.
Gracias, doctor. Y en seguimiento también a esa misma pregunta,
Thank you very
hay una
much. And
consulta
also, as a
que
follow-up
nos
to
llega
that
de
question,
Rolston
we have
Seniors,
a consultation
de
from
El Business
Roston
News Senior Reporter
Edwidna, senior
en
reporter
Bahamas. Es
in
similar,
Bahamas, and
vinculada
this is
con
similar and
COVID
is also
particular.
related to the
Y
Caribbean in
dice que el
particular.
1 de
And it
julio
says that on July
Bahamas is
1st,
opening its
Bahamas
borders to
is opening
travelers
up its
from the US, Russia, and
borders to
Brazil.
travelers
And the
to
question
Russia,
is
the US,
does
and Brazil. And the question
WHO
is,
requirement for entry act as a sufficient safeguard as the Bahamas has done?
Well, as you know, the test is, if it is negative or if it is positive, it is something that is related to the moment that the test was taken. So, and there are many cases that the people will be asymptomatic and the test may be negative. So if the person is take the test, let's say 1 week before traveling, and they go to the country, they may still have the disease. So this is one of the criteria that is being evaluated, and we'll need to look at that very carefully, considering especially that all the filters and the screenings at the borders, both at the points of entry, but also at the exit borders, have not been successful during this pandemic and any other pandemic, by the way. Thank you.
Gracias. Siguiente pregunta, me gustaría darle...
Thank you. This is another question, and I would like to offer Alina Diester from AFP the opportunity to ask this question live. Alina, you have the mic.
Hola, ¿se escucha?
Can you hear me? Yes,
Sí,
we can
buenas
hear
tardes.
you. Good afternoon.
Quería saber en relación a los
I
casos
would
de
like
dengue
to
que
know
se han
in connection
reportado
with the
también de
dengue
chikungunya y de
cases
Zika,
and
si están
chikungunya
notando una
and Zika
concurrencia
cases,
de esas
whether you see
infecciones
some
con
sort of concurrence
COVID-19
among
y cómo
these
afecta el
infections and
control de esas enfermedades
COVID-19 and how the
epidémicas el que
control of
estemos en
these
medio de una pandemia.
epidemic
Y por otra
diseases
parte, me
is
gustaría
impacted
saber
by the fact
sobre
that
la
we are in the
malaria,
midst
que
of
también
a
impacta la
pandemic,
región,
and
qué cifras tienen y
like
si
to
han
ask you
detectado un aumento de
about
los
malaria,
casos.
whether you have new figures and whether you have seen an increase of cases. Thank you, Alina. Dr. Espinal, could you please address this question? Yes, thank you very much, Alina. The truth of the matter is that any pandemic or outbreak does have an impact on the follow-up that we give to other health problems. Therefore, Paho has always called upon our member countries and regional governments to protect those priority programs and also those programs where we see gains, not only in the area of dengue and malaria, but also immunization for TB and HIV. So we should not be distracted. We should pay attention to COVID, but also to the other diseases, because they do not wait. Diseases do not wait. Now, as to dengue, we have seen, and as you properly indicated, we have seen this in 1.6 million cases, but we also saw a decrease in the southern cone, not in other areas, but this could also be due to several reasons. For example, they just concluded summer, but also many of our workers have to move to work during the pandemic. So this could also be due to the fact that since we have social distancing and we have quarantine, mosquitoes do not circulate freely and they also have fewer opportunities to bite. We need to remember that the dengue mosquito is a daytime mosquito as opposed to malaria, where we have a nighttime mosquito. So what we have seen with malaria is that there has been a decrease in connection with vis-a-vis the same period last year. But at this time last year, there was an important, significant increase in Venezuela, but now there has been a decrease of malaria cases in Venezuela. But this may be due to several factors, as I just mentioned. But we have also seen a decrease in Brazil and in other countries in the region. But also, paradoxically, we have seen other increases that are focused in other countries. The message is to protect the gains and also to protect programs to invest in health, as Madam Director just mentioned, because the diseases are not going to wait for COVID to disappear. So we need to bear this in mind. And Paho has also published the press note on dengue, chikungunya, and Zika this week to be able to alert countries that these diseases continue to be epidemic and that due attention needs to be paid to them. Thank you very much. Thank you, Doctor. Now, the following question we have is from Angeline Montoya from Le Monde. Some questions have also decreed an early quarantine when there were only few cases. Hasn't this been negative? as we look at this throughout time. Dr. Barbosa, could you please address this question? Yes. All of the evidence shows that the countries that implemented social distancing measures late had a very significant increase of cases, as we saw in northern Italy and also here in New York and Guayaquil, Ecuador. Therefore, social distancing measures need to be implemented early during the transmission so that they do have the impact of preventing a rapid transmission that could have a high number of acute cases that could overwhelm the capacity of the ICUs, hospitals, and other treatment centers. In Latin America, in several countries, those measures were adopted, and as a result, transmission was delayed or the rate of transmission was decreased. We have a mosaic of situations in those countries and among countries, and also within the countries themselves, various states and provinces that have situations that are more in control than in other provinces and states that do have significant transmission. So I think that at this point in time, in connection with transmission, since we see increases, we need to determine the causes for the social distancing measures and what we can do to adopt measures that could be more effective, what could be done to increase social protection, social welfare for people, and also how to protect poor families so that social distancing measures may be as effective as possible and decrease transmission and also save lives, which is the main goal they have. Thank you. Thank you, Dr. Barbosa. Now we have Linda Stryker from Granada. Question.
In particular, the sub-region of the OECS has recorded the least number of cases and deaths, and some find it unfair that there is no distinction as to the difference between CARICOM bloc and South Latin America. Can you explain why the CARICOM bloc must be included in the Latin America data? Dr. Aldiguieri?
Thank you for this question. It's a very good point regarding how to reflect the situation in subregions, including in the Caribbean community. We have different sets of countries as in the Caribbean. First, we have a Caribbean-wide, including Caribbean mainland countries and other islands, French-speaking islands. So in this Caribbean-wide group of countries, we have an accumulated data of more than 47,000 cases reported to Paho during the last month. This includes Haiti, the Dominican Republic, Puerto Rico, and French Guiana. Within this big block of Caribbean countries, both islands and mainland countries, we have a block of countries of the CARICOM, of the Caribbean community. And in these countries, we have a report of 1,650 cases as of yesterday, as of 22nd of June. Within this CARICOM community reports, we have a subset of reports, including the countries of the Organization of Eastern Caribbean States, including Antigua, St. Kitts and Nevis, Antigua and Barbuda, St. Kitts and Nevis, Dominica, St. Lucia, St. Vincent and the Grenadines, and Grenada. And for these countries, we have a total report accumulated of 140 countries. In some of these countries, we have no cases reported from 6 days ago to 65 days ago. So you see really the three big blocks of in the Caribbean. However, what I would like to flag in countries that have reached excellent results with implementation of very strict public health measures and social distancing, is that when the adjustment will be made, including with opening the airspace, there is a high risk of importation of cases in these countries and to trigger again a transmission on within the country. So really, we, as other of my colleagues during this press conference, we would like to flag the importance of the planning and organization of the adjustments of the travel-related restrictions, including with a very strict surveillance and including with contact tracing capacities in place for controlling any importation of cases when the country would resume some level of international connection. Thank you.
Gracias, doctor. La siguiente pregunta viene de...
Thank you, doctor. Now we have the next question by Matias Onewi from Medscape in Spanish. As the lockdown and social distancing measures continue, do you think that depression, anger, anguish are factors that could go against the fulfillment of these measures? Dr. Espinal? Thank you very much for the question. It is a very important question related to what we have already mentioned as to the need to strengthen and to facilitate access to services that offer guidance and mental health, because during quarantine, when we need to spend time within the confines of the home and kids cannot go out to play, these situations may be a vehicle to give room to give way to anxiety, depression, and situations that make us upset. And that is likely. It is normal for this to happen, but we need to have access to those services and also the recommendations, and also visit websites of organizations such as WHO's and Paho's, where they will find recommendations to facilitate management of the situation. And also, it is important not to read all of the news. That also triggers anxiety. They should read a book, have a video conference with family members to take a break from work, to have some sort of entertainment. This could happen, yes, but it is also important to remain calm, because if we become upset, we may also go into more serious mistakes. And Paho has also called upon the countries to guarantee that guidance and also access to health workers, psychologists, psychiatrists, and also social workers who have experience, who can also help and guide our populations. Thank you very much. Thank you, doctor. The next question comes from Bloomberg by Sebastian Boy and Andrew Rosati in the chat, and it reads,
insight on what's going on in the southern and southwestern US states like Arizona that have been steep spikes in cases, but so far without a corresponding rise in deaths? What are possible explanations? Doctor Barbosa puede tomar esta pregunta.
Thank you for the question. The US, we see the similar situation that you see in many other countries in the Americas. It's a vast country, so we have many different epidemiological situations. We can see clearly that in New York, that was the epicenter of COVID-19 many weeks ago, now the situation there, the transmission is controlled, and they are starting opening the economy in a very well-planned way. In other states in the United States, we are seeing the states that you mentioned, Florida, Arizona, and other states, we are seeing an increase in the number of cases. Of course, that this called the attention of the governors of these states about what public health measures need to be adopted, what are the effective measures to reduce the speed of the transmission. At the same time, when you have a situation like you described, that the number of cases are increasing and the number of deaths is not increasing, maybe this is a good sign of that the access to PCR tests is increasing in the community. But I think that is better safe in this, the better safety option in this case is to monitor very carefully what's happening, and if the transmission is increasing, if you are experimenting an increase in the number of cases, public health measures need to be adopted, and public health measures that have already been very well proved to slow the transmission. So this is the situation that probably we will see in the next weeks and months, maybe. They need to monitor because in no place is safe. If the transmission starts, you need to adopt prompt measures to reduce the speed. This is the way that we see the near future for us. Thank you.
Gracias, doctor. La siguiente pregunta.
Thank you, Doctor. The next question is from Daniel Collins from TN23 in Guatemala. The question is, how does Paho read the situation in Guatemala, the level of infections and deaths that have increased significantly? Dr. Ugarte, could you answer this question, please? Thank you. Well, the situation in several countries, Guatemala being one of them, is that there's been an increase in cases. We understand that several adjustments are being made, not only in terms of information management and follow-up on cases, but also restructuring health services, as well as distribution of personal protective equipment. We believe that those measures are highly timely in helping control the epidemic. So we will see scenarios such as what we see in Guatemala and other countries as well, by the way. However, these adjustments that have been made lately have support from the organization at all levels, and we hope that they will be successful. Thank you. Thank you. Next question, Luis Madrigal from Delfino.cr, Costa Rica. It says Central American countries are seeing increase in numbers of positive COVID tests. Yesterday, Guatemala saw a 70% positive rate, and Costa Rica is above the 10% recommended by WHO. Does Paho have reports on reduced testing capabilities in the region due to lack of resources or equipment? Are there exceptional cases where this 10% positive rate may not be as a red flag? Dr. Aldigueri, could you please answer this question? Of course, and thank you for those questions. In Central America, all countries have seen increases with the exception of Belize, where there's still sporadic cases. All countries in Central America have the capabilities to perform molecular PCR testing. They do have trained staff and labs that are equipped to process the tests. And the majority of Central American countries have decentralized a lab to other departments or neighborhoods or cities. All countries in Central America report their data on a daily basis with one exception, which is Nicaragua.
con una buena captación de casos de
With
estos
good
clínicos, en
identification of
general
clinical
un aumento
cases or
de
catchment of
la
clinical cases and
positividad
an increase
es un
in,
indicador de una tendencia
in positive
creciente
cases indicates
de
that
la
there's
epidemia.
an increase
Un aumento
in
superior al
cases as part of the epidemic.
10-20% ya
A
es
10 to
un
20% increase
indicador de intensificación
is an indicator
de la
that shows
transmisión de la
that
epidemia.
transmissions are
Un
indeed increasing.
70% refleja
70%,
tal vez
a
una
70% rate
necesidad
may
de
reflect a
ampliar
need
la cobertura
to
de
broaden
laboratorio
the
a nivel
lab
de atención
network
primaria, porque
to
las
the primary
tasas de
care level
70%
because these 70%
denotan una
rates
concentración
show
de la cobertura en
that
casos hospitalizados. Son cerca
that cases are
pero
concentrated in a
en
hospital
este
settings.
momento, América
But
Central
at this point,
cuenta con todas las
Central
capacidades
America
de laboratorio
has
y
all of their
desde
lab
el
capabilities,
mes de febrero
and Paho started
apoyado
back in
en la
February, had started
capacitación,
providing
ayuda
training
a distancia en
uh,
este periodo de Navidad
remotely
internacional
during
de
the
difícil viaje internacional.
international
Arreglaron
travel
los problemas
ban.
técnicos en los
We still
laboratorios
provided
y
help
este
to
tratamiento,
labs, and it
enviamos
continues
a las redes
to
nacionales de laboratorio
provide the
todas
national lab
las
networks with
sondas iniciadores para las pruebas
all of the
moleculares que se
equipment
requieren en
that
este
they
momento.
need to
Gracias.
perform the molecular testing. Thank you.
Gracias, doctor. La siguiente
Thank you,
pregunta
doctor.
es de
And the
Isabela
next question is
González
from Isabela
de Reforma en
Gonzalez from
México.
Reforma in
Pregunta,
Mexico.
quiere
The
saber si
question
la OPS
is, I would
considera
like
que
to know whether
México ha
Paho
logrado
thinks that
aplanar la
Mexico
curva
has
epidemiológica
managed to
del país.
flatten the
Doctor Barbosa, ¿podrías
epidemiological
responder
curve
esta
in the
pregunta?
country.
Gracias,
Dr.
gracias,
Barbosa,
Carla.
could you answer?
La situación
Thank
de
you for the
México en
question.
México es muy
Mexico's
semejante
situation
a
is
Perú,
very
a
similar to
Brasil,
what happens in
Argentina,
Peru,
pasa
Brazil, or
neste momento
Chile.
por un período de crecimiento de la
That is to say,
enfermedad.
it went through an increase in number
Seguro
of
que en México
cases,
tenemos
and I'm
situaciones
sure that
específicas
Mexico
en
has
nuestros
certain
estados y
things that
México
make it
es muy
different
importante no
by
tomar
state. Again,
el
it's
promedio
very
de números del
important
país
not to
considerando la
take the
situación
country
de cada
average
uno
as
de estos
that being the
países.
norm in
Pero
every single
cuando
province,
tomamos México como
but
país,
when we take
en
Mexico
las
as
últimas
a
semanas
country,
hay una
over the
tendencia
past few
muy
weeks, we
evidente
have
de
seen a
crecimiento del
very
número de
evident
posibles casos.
increase in number
Las
of
autoridades
cases.
de México
And
están
Mexico's
apoyando
health
el apoyo
authorities
de la
have
Organización
support
Panamericana de la
from the
Salud
Pan
para
American
revisar
Health
los datos,
Organization to
para
review
mirar qué
all of their
otras
data
medidas se
to
pueden
see
adoptar.
what other measures
Principalmente
could be
las
taken
medidas de distanciamiento
or
social más
whether they
efectivas
can
y la
make social
protección de los
distancing
servicios de
more
salud
effective
de
and
manera
provide
a
health
más rápido
services
posible
uh,
controlar
in order
una
to
transmisión.
quickly and effectively
Gracias.
control transmission. Thank you.
Gracias, doctor. La
Thank
siguiente
you,
pregunta
doctor.
es de
The next
Mariana
question is
Souquet
from
de
Mariana
Efecto
Souquet
Cocuyo en
from
Venezuela.
Efecto Cocuyo in
Dice,
Venezuela.
han
And it
pasado dos
says,
semanas desde que se
two
anunció
weeks
el
have gone
acuerdo de
by since
descentralización de pruebas
the
moleculares en
agreement to
Venezuela.
decentralize
¿Ha habido
molecular
algún
testing
progreso
happened
sobre
in
este
Venezuela.
tema?
Has there been
¿Se ha
any
avanzado
progress
en
in
algún
this
otro
regard?
punto del
Has any
acuerdo?
progress been made
Doctor
in
Ugarte,
any
responda a
other
esta pregunta.
uh,
Sí,
aspects of the agreement, Dr.
se han
Ugarte?
identificado laboratorios
Well,
donde
we
pueden
have
hacerse
identified labs
pruebas también,
where
tanto
testing
el
can be
Zulia y otros
done
laboratorios,
in Zulia
y se ha
and other
procedido a
labs,
identificar
and
las
we were able
condiciones
to
de
identify
seguridad y de
the
calidad, tanto
safety
del
and quality
equipamiento
conditions both
como de
for
las
the equipment
instalaciones
as well
y
as the
el tratamiento del
facilities
personal.
and
Por otro
training
lado,
of
se
their
han
staff. On
realizado
the other
nuevas
hand,
reuniones
we
donde se han
have held
identificado los
more meetings where we
elementos, los suministros
identified
y
the
que son como más
supplies
urgentes y la
that
priorización
are
de esos suministros.
pressing,
También
and
se
we
ha discutido
prioritized
sobre
those supplies. We
el
have
nuevo
also
protocolo de
discussed
tratamiento,
the new treatment
verificando cuál
protocols
es
that
la
need to be in
disponibilidad
place,
de los
and we
suministros en este
see
momento y
we
cuáles
saw what
son
kind of
los que
availability
podrían estar
exists right now,
disponibles para
or what could
los
become
usuarios.
available
También
soon to
se
be given to
decidió
hospitals.
en monitorear la situación y
We
la
also
disponibilidad de
made a
equipos
decision to
personales
monitor
en
the
hospitales
availability of
psiquiátricos,
PPE in certain
conjuntamente
specific
garantizar
hospitals,
que
and at the
esos
same
equipos
time
tengan personal
ensure
y
that
puedan
those
estar
PPE
disponibles
will
para
be
todo el personal.
made available
Eso
to
es.
the staff as a whole.
Gracias.
That's it. Thank you.
Gracias, doctor. Y ahora sí, ya
Thank
estamos
you,
llegando al final
doctor.
de
And
nuestra
we are
sesión.
nearing the
La
end of our
última
session.
pregunta viene de
So
Matt
one final
Rivers
question
de
from Matt
CNN
Rivers
que
from
preguntó,
CNN.
how
And the
concerned
question
is
is,
Paho about the reopening and what risks does reopening bring? Dr. Etienne.
Thank you for this question. So from the 2nd of March 2020 onward, all but one of the 35 member states, with the exception of Nicaragua, adopted community-wide measures to restrict population movement. These were initially successful in slowing transmission, but within just a few weeks, questions arose as to the social and economic sustainability of these measures. So these concerns, compounded by a false sense of having brought the pandemic under control, have led some countries to start relaxing the measures. We have reiterated that a whole of government and a whole of society approach is required to strike a balance between public health and socioeconomic priorities and interests. Let's face it, the Americas is not one country, one city, or one town. We are facing what we have described as a mosaic of scenarios, even within countries. So this means that countries must exercise flexibility in adjusting measures in either direction, either in the tightening or the relaxing of them. And that should depend on the transmission scenario and the health, economic, and sociological data that is available. For example, in countries that are highly dependent on tourism, resuming non-essential international travel by air and sea will involve the implementation of measures at points of entry and in the hospitality industry itself. These measures must be taken based on global, regional, and national scientific evidence, as well as the capacity of the national health system. To facilitate critical decision-making processes, countries need real-time information on key health services indicators, for example, available bed capacities. And they should also have a system in place for the early detection of suspected cases, testing, isolation, contact tracing, and quarantine. I think we need to reiterate, they will need stronger health services with access for all vulnerable groups without the need for out-of-pocket payment or even worse, payment at the point of service. I think we need to reemphasize that going forward, countries must commit to invest in health. They need to commit at least 6% of their GDP, and they need to ensure that at least 30% of the public health investment is allocated to the first level of care and to essential public health functions. We must not be caught in this situation again. Thank you very much.
Muchas gracias, doctora Etienne, y a todos.
Thank you very much, Dr. Etienne, for all of our speakers and for all of you to be part of this session. In a few minutes, we will be giving you the opening remarks and as well as a recording of the session, and you can be in touch with us through the via email, and we will try to answer questions as quickly as possible. Next week, we will resume our Tuesday 11 a.m. Washington, D.C. time. So we hope to see you on Tuesday, and you will receive our email inviting you to that session. Once again, thank you very much for connecting to the session, and we hope to see you next week. Thanks.